Hi there, I'm Cherise Branch, a functional nurse practitioner, and I want to talk to you today about how you can heal your gut, heal your body. This is one of my favorite topics because if you start to learn how to heal your gastrointestinal system, you have the ability to treat, manage, and even reverse so many common conditions that patients see the doctor for. When I see patients in the office, the common reasons are things like this: fatigue, stomach problems, high blood pressure, pain. All of these may seem disconnected, but we all know when we see the doctor, we want to figure out what the cause of our symptoms are or the cause of the disease because we want to feel better. So let's go back a little bit to biology. When we were learning about all the different systems in our body, we learned about the circulatory system, digestive system, nervous system, so on and so forth. We learned about them as though they were separate systems, as though they have their own life in and of themselves. Now this parallels how things operate in medicine sometimes. We have the doctor for our neurological system, we have the orthopedist for our skeletal bone system, and the cardiologist for our circulatory system. But we all know that intuitively they're all connected. In functional medicine, we know that there are systems that connect these other bigger systems that I've just talked about. By understanding that the gastrointestinal system is very important and it connects all these other systems together, we have the ability to fix the entire body by addressing that very important GI system. When we look at our diseases, we recognize that we want to flip that arrow. We want to be less disease-focused and more focused on the root cause. The GI system, we will find, is at the root cause of so many of the conditions that you may be seeking treatment of. So let's explore this even further. How can we help our bodies? Well, first we have to understand how we fail our bodies and how we fail specifically the GI system. We recognize that we eat the wrong foods many times. Our popular culture is full of food ingredients that may or may not be good to our GI system. Hydrogenated oils, foods that have been manipulated by man and not looking the way they came out of the earth. Looking at things like sugar, fat, and salt when they're put in unnecessary amounts in our food. Then, of course, taking nature's formula for food and genetically modifying it and making that food now somewhat of a perceived enemy by our immune system. It tends to turn on inflammation. We might become allergic to that food or become intolerant. We also recognize that we sometimes eat too much, and that puts a burden on our GI system. Any system has limits, and we have to recognize how to treat it wonderfully in order for it to treat us wonderfully, help our bodies heal, and optimally work. The other thing we might do is eat too fast. Again, it's a matter of looking at our machinery, our systems, and understanding what's the best way to get the lifelong health out of that system. So in order to get that optimal health out of the entire body, we recognize that the GI health system and the function of that gastrointestinal system is pivotal. There are 4 pillars that I want you to think about. 4 pillars that define the GI system: digestion, elimination, microflora, and gut integrity. Now these are something that we want to focus on today. We all think about digestion and elimination, and we'll talk about that a little further, but you might not remember that in the gut there are many places where good bacteria and good germs live, things that help us function. We want to make sure that we help those good guys and keep them in there in the right amount. We also understand that the lining of our whole digestive GI system is very important to the entire function of the body. Just as the skin on the outside of our body protects us, the skin that lines everything from our mouth to our rectum is also very important in terms of defending us. Actually, there's a statistic that says that in one day, your GI lining defends itself as much as your skin on the outside does for an entire lifetime. Now, how do you do this? Well, you have to look at your genetics, but you have to have the power to modify your diet and your lifestyle so you can maintain those 4 pillars of GI health to be able to get you to the optimal health that you desire. How do you achieve this? Let's start by looking at it in a little bit more detail. So there's a system that we use in functional and integrative medicine called the 4 R's. Now we've actually expanded that to a 5th R, but for the sake of this visit, we need to understand that we need to remove our first R. Remove those things that can be harmful to our system. Allergens, toxins, other germs that we don't want in our digestive system. We also have to recognize that we have to replace things that we might have lost, like acid, digestive enzymes. We recognize that we must also re-inoculate, which is a fancy word for replacing those good bacteria. You may know of them as probiotics. You may hear about them in terms of certain foods having higher amounts of probiotic to put back what the GI system needs to function properly. Last but not least, we have repair. Many times when we eat the wrong foods or have issues that affect that lining we spoke about, we need to repair it so it's nice and strong to defend us against the environment outside. So let's look a little bit more about how we must process food, because it's not just there in a simple format just to be able to get food into your system, then get it out. It goes through a specific process. Let's take the example of a carrot. You start by chewing the carrot. Now the carrot starts changing shape. In the stomach, there's acid that's added. Now, just for the sake of illustration, let's say the shape changes to this cloud-like puff. Then the food or the puff travels its way to the small intestine. There you have the addition of digestive enzymes, the right ones to be able to process that carrot even further down to this shape here. Last you go and you have it ready for inspection. Because it's gone through these multi-step processes in order to make it the right appearance, it's ready for inspection by the small intestine lining. Now these pink cells that you see here with the little villi or little hairs, these are enterocytes. They're critical for your health because they are the basis of your GI health. So let's look at that a little bit further. There's a perfect pathway. We talked about how the food has to change shape so it's ready for inspection. So when it's ready, it gets a VIP pass, travels through the entire site, and turns into a different shape. So let's just say that shape's a heart. Now that heart's now in the bloodstream, and you see all those green little circles with the plus signs? That's our symbol for the immune system. 70% of your immune system lies right there in your gut lining. It's there to be able to detect any intruders that might make it through that small intestine lining. If only hearts are coming through, the immune system stays very happy. It says hearts are good for us. We know it went through the right security system. You're okay to travel through the rest of the body. Now we know that all systems are there to help us for protection, but not all systems are foolproof. Let's look at what can happen. When we take things like antibiotics, bad foods, things that have germs on them, or stress, my favorite, we can damage the lining. In this example, notice how the probiotic layer up at the top of those enterocytes is a little bit patchy. Now we also have areas where they don't have any pink enterocytes standing shoulder to shoulder. So our gut integrity has now been compromised. We now, instead of having a tight brick and mortar system, we have some gaps. And we call those tight junctions in medicine. When you lose those tight junctions, you're losing the integrity of that barrier. So now what happens? Remember that star? Assuming that your food got digested appropriately and is ready for inspection, it can accidentally pass through one of these gaps. And when it does, it didn't turn into a heart in the previous example. So the immune system says, uh-oh, these are not the hearts that we consider safe. And so the immune system becomes activated and becomes inflamed. Now the system is in a defense mode and it's not in the mode of healing anymore. This, when we look at it in a more complex diagram, where physicians or nurse practitioners, we look at all the different things that can actually fall through those gaps. When we have those gaps, we call that increased intestinal permeability. Again, just fancy words that say our barrier is no longer intact and things are leaking through. So now when they leak through, you can tell how that immune system has the potential to be very overwhelmed and it can become weak. It becomes distracted because it has so many things that are falling through those cracks per se. That can lead to the immune system tagging certain foods as intruders, even though they aren't really harmful at the beginning of the process. But now the immune system, again, it's been distracted and it's tagged it as a food allergy or food sensitivity or an intolerance. This can proceed on and on and on to cause more and more inflammation that we know about and lead to autoimmune conditions. Again, because the immune system's overwhelmed. So now what else happens? Well, we know that when there is all this commotion happening at the level of the GI lining, it affects all the other functions of the GI system. Remember that bloodstream that's completely in alarm state with the immune system? That is traveling throughout your whole body and creating alarm signals everywhere. This is where we get the whole title, Heal Your Gut, Heal Your Body, because it can stop inflammation down at the core of your GI system. You have the ability to fix all inflammation-related disease in some way. We know that these are all connected to that core concept. Look, cancer, cardiovascular disease, diabetes, autoimmune diseases, pulmonary disease, all of these could have a root in inflammation and therefore a root in your gut and your GI system. Now let's look at a popular concept that makes a lot of sense to some of my patients, and hopefully it'll make sense for you too as well. Let's suppose you were given this beautiful Lamborghini and you thought, oh my goodness, this is a wonderful piece of machinery. I need to take care of it very well. Well, think of this as your body. Now, if you had this expensive, wonderful, state-of-the-art machinery, I bet you would take very good care of it and make sure that it got the exact fuel it needed to perform at its best. You likely would not go to the gas station and just fill it up with any old cheap gas. You probably also wouldn't fill it up with the wrong fuel, something like water. Even though water is inherently good for many things, you probably recognize that putting water down the gas tank of your Lamborghini, wouldn't be such a wise idea for the performance of that Lamborghini. If anything, it could be very harmful. Well, foods are no different. There are many healthy foods, common foods like wheat and dairy, that could just be the wrong fuel for you. Just because they're healthy in general for the public does not mean that it cannot be the wrong fuel for your Lamborghini and your body. Let's look at that a little bit further. We probably already know a friend or even ourselves who felt better when we take a certain food out of our diet. Again, wheat and dairy are common ones. When we remove that allergenic food, we might notice a huge improvement, not just in our digestive systems, but by maybe in terms of brain fog or headache, or maybe your skin looks a lot better, or maybe you're breathing differently. We recognize that food and taking those foods that can be triggers for your disease or symptoms, taking them out of your diet could make a huge difference. But remember, not all food is the enemy. There can be a food that gets tagged by that immune system as an enemy. And when it does in medicine, we call that an adverse reaction to the food. And that's just a fancy way of saying that you're having a negative or a negative reaction that you really don't want, a reaction to the food. Even though you like the food, your body is giving it a negative reaction. Now, it can be very many different names. You can have an adverse reaction, an allergy, sensitivity, or an intolerance. These are all just like the military if you think about it. They're there to fight the enemy, but there are different kinds of military teams that we have to handle different kinds of enemies. This is kind of our way of understanding the different types of adverse reactions to foods. Now, one of the most common ones you might know about, one of the most severe, is that related to peanuts. You might have a child or know a kiddo who has such a significant issue, and it's an extreme adverse reaction where they have anaphylaxis. But most of us don't have those extreme reactions. What we have is something much more common, non-anaphylactic food reactions. Whether they're an allergy, sensitivity, intolerance, they make up 95% of food reactions. These symptoms are a little trickier because they can be delayed, hours to days later. And so you don't really see the connection as you would as if you had just swallowed a peanut and your lips got swollen right away. These symptoms can be very vague as well, vague to you, and until you identify the connection. They can be as obvious as hives or eczema, difficulty breathing, but they can be as vague as headaches, or maybe you just feel more tired or brain fog. The list of these symptoms, it's too much to fit on one page, but we see things like depression, anxiety, psoriasis, migraine headaches, and they all can be linked back to an adverse reaction to the food and linked back to the health of your GI system. In order to figure out if you have one of these food triggers, it takes a little time because, again, your goal is you want to reduce those triggers in your system to reduce that incoming garbage and that incoming inflammation. Your provider may decide to do some testing and give you some extra support in the process. They may decide to do skin prick testing, intradermal testing, maybe order some blood labs. The other thing we may request of you is to do stool testing. But one of the most common things that I like to do is to recommend an elimination diet. We love elimination diets because they're simple and very effective. They're also cheap. It means identifying certain foods that could be triggers and eliminating them from your diet 100%, just 2 or 4 weeks. This can be extended longer in some particular cases. But when you eliminate those potential triggers, your body may feel so much better. Your symptoms, your diseases may start to reverse, may start to lessen. Your meds, your medications might not be as necessary anymore. Then after that elimination trial, your provider will show you how to provoke a reaction by reintroducing the food. If that symptom, let's say it's a headache, comes back with a vengeance when you reintroduce, let's say for example, dairy, then you know that's a food trigger. This is a wonderful way to start cleaning up that system. These are 6 most common foods that can cause symptoms in the whole body by affecting that GI system. Things like eggs, dairy, nuts, shellfish, wheat, and gluten. But that list can be expanded. Whatever you eat more of has the potential to leak into your system and then trigger the immune system. So the list can go on based on what you eat the most. One of the little pearls that I have is if you crave a certain food, it may be a food that your body's actually reacting to. We will understand that we want to eliminate those bad foods, reducing our inflammation, and that we use testing and support in order to do that. But there's another thing I bet you're thinking about. What happens when I identify that? What about all the garbage that I've created through this lifetime where I've been taking wheat, dairy, soy, and not realizing that it was causing my issues? How can I get that out? Well, that's the other goal of the GI system, elimination. Now, elimination, many times we think of by thinking of our colon and thinking it has the job of elimination, but it's much, much broader than that. Remember, elimination as a big umbrella means taking out all those bad things, allergens, toxins, harmful organisms, but also, of course, having regular bowel movements, having a wonderful system that helps you urinate appropriately with good hydration, with good water. We recognize that there's 4 main ways that our body takes out the trash. It uses the colon, the kidney, the skin, and the liver. It does this because it recognizes that making garbage is inevitable, just like in our own house. But the goal is not to make so much and to have good systems to take that garbage out. Your liver is also very important as a blood filter and a garbage removal system. It actually acts as a security guard. When your food goes through those enterocytes in the bloodstream, the next destination is to the liver. That's because the liver is a security guard, and there and then can decide, you know what, I don't want you to go any further into our system. It can stop harmful toxins from making it even further. It's the home of phase 1 and phase 2 conjugation. These are fancy medical words that basically say this is the home where we eliminate toxins from our system. Remember, be good to your liver and be good to your colon and your kidney and your skin, because these are parts of your entire waste disposal system. You want to take care of them so they can continue to take care of you. So what can you do to help? Well, consider eating like a bird. Many times we can overburden our GI system just by eating too much. So eat small, maybe often, maybe as a general rule of thumb, decrease your calories around 20%. Eat with mindfulness. Slow down, enjoy the food, chew, put the fork down between bites and savor the flavor. Try not to be distracted by TV, reading, the computer, your cell phone when you're eating, because then you're less likely to overeat. We recognize it's important to eat when you're hungry, not just bored, tired, frustrated, sad, mad, or if you see a billboard with a delicious burger appeal. You want to eat when your body says it's hungry, because it will regulate how many calories to eat that way. You want to make sure you eat clean foods. We talked about eating foods that came from the earth, less often manipulated by man. Plant foods are wonderful. We want them to be minimally processed whenever possible so that it has the true natural benefit intended for your body. Think about using veggies, beans, fruit, oats, grains that are healthy. You also want to avoid those foods that may have been found to be triggers for you. Maybe wheat, maybe dairy, it could be any known trigger, but you want to avoid it in order to preserve that gut lining so it can help you out. How about eating anti-inflammatory? You may have heard about this. One of the ways you can help yourself is to eat good fats. Fats are not all bad. You want to prioritize those good fats from good healthy fish like salmon, flaxseed, chia seeds, olive oil, good olive oil. You want to avoid those bad fats that you find in some vegetable oils. Avoid trans fats completely. Those are those hydrogenated oils we talked about earlier. Avoid margarine. Avoid fried foods. Those are oxidized, highly heated fats, and avoid those baked goods, my personal favorite, that you know have those unnecessary bad fats. Remember, the Mediterranean diet has been proven to have those wonderful fats in it. Don't reinvent the wheel. It has many plant foods, again, to help your whole body reduce inflammation. One last little bit of advice. Consider what your granny might have told you. Eat a big breakfast. Eat breakfast like a king, then eat lunch like the queen and dinner like a pauper. Because if you do, you'll notice that you'll be leaner in your midsection. You'll be trimmer, you'll have more muscle, less fat, and more energy. If you flip it around like many of us might do, where we eat a small or no breakfast, eat lunch even bigger, and then have a big dinner, then relax by sitting in front of the TV and going right to bed, we recognize that our weight tends to travel to that middle zone. Just think of this picture. We recognize that when you eat the right quantity, quality of food, and time it appropriately, you can really find better health. One of the things that many of my patients talk about is that they find it very inconvenient to eat breakfast, or it's difficult if I tell them if they're allergic to dairy or wheat, how can they find day-to-day good food? Consider using a health shake that's picked personally for you so you can have that one meal already taken care of, as it's so important to maintaining your body composition that helps you stay healthy. So we've seen how Western and Eastern medicine come together beautifully with functional and integrative medicine. You understand a lot better when we say no guts, no glory. You see that connection. You recognize that the world is round and the place which may seem like the end may also be the beginning. I hope you consider joining me on your own health journey. And remember, 9 times out of 10, it begins with gut health. Thank you.